Did you know that the cost of insulin and daily monitoring for diabetics can consume as much as half of the family's average disposable income? What about a patient whose family, in severe cases, is unable to afford or even access basic necessities to fight or manage that condition? Well, here are some proposed solutions: prevention, support, and taxation. As we commemorate World Diabetes Day, we are putting the spotlight on how best families can manage the increasing spate of cases. Here's Kenneth Awoche-Dakon's report.
Diabetes is a group of metabolic disorders in which there are high blood sugar levels over a prolonged period. Symptoms include unintended weight loss, increased urination, increased thirst, and increased hunger. In Ghana alone, over 8,300 people died of the disease in 2013 and another 5,000 in 2015. The theme for this year's World Diabetes Day, the family and diabetes, has brought to the fore the need to create a support system for those affected by diabetes. According to Deputy Head of Care at Diabetes UK, Douglas 24, a very strong family foundation is an essential step in improving the health of such patients.
Because we are not doing we are doing almost nothing, which for me is not an option. So for example, if somebody has type 1 diabetes, how they manage their diabetes is that every time that they are going to eat, for example, they are going to eat fufu, they have to count how much carbohydrate is in the fufu. That's a huge task. And they need support. They need support from the family. Also, some people even think that if you have diabetes, you have to cook for yourself. So there are people who will prepare food for the rest of the family, and then they will have to prepare their own food, which makes the social aspects of eating a bit, non-existent. So it affects people's emotions as well. For me, the theme for this year's Diabetes Week is that we are going to raise awareness of diabetes first. And the reason for that is, if you have a family member who has diabetes, your risk of developing diabetes increases.
According to the International Diabetes Federation, an estimated 382 million people have diabetes worldwide, with projections to 300 million by 2025, with majority of this increase to come from developing countries. While Ghana's health ministry has taken certain steps to tackle the disease, the specialist dietitian believes the efforts should be channeled at preventive measures.
First of all, the government has to make some resources available to raise awareness of type 2 diabetes, but also think of some policies to help people live healthier lives. I'll give you an example of what's happening in the UK. At the moment, the government is committing money to putting together a diabetes prevention program. And that program is for people who have been screened and have come out to be at high risk of developing type 2 diabetes. So they give them the necessary dietary and lifestyle advice in order to manage that risk.
Consequences of a neglect of diabetics can be devastating, not just to the immediate family. Data from the World Health Organization indicates that from 2011 to 2030, losses in gross domestic product worldwide due to diabetes are expected to total $800 billion for low and middle income countries such as Ghana. In view of this, Douglas 24 believes the implementation of a sugar tax coupled with a substantial subsidy to insulin shots is the way to go.
But they are not ending there. They are also looking at population-based interventions or population-based policies. One of them is that they've put a tax on sugary drinks, which means that all the sugary drinks here, the energy drinks here, if you're going to buy, you pay more, and the government will use that money to then help prevent type 2 diabetes. But the other side of this is that because it's a bit expensive, people will not buy too much of the sugary drinks, because we know drinking too much sugary drinks can increase your risk of type 2 diabetes. Without insulin, people with type 1 have about a few weeks, months maximum, to live. Without insulin, they will die. So it is absolutely critical that government commits funds so that insulin, at the bare minimum, insulin becomes free.
So as we commemorate the World Diabetes Day, the responsibility of a family remains essential in curbing the disease. Kenneth Awatre Darko's report for JoyNews.